Bloating is a condition where your belly feels full and tight, often due to gas. Bloating, gasiness, and abdominal discomfort aren't limited to the occasional holiday feast. It is seen that 1 in 10 people suffer from bloating regularly, even when they haven't eaten a large meal. In some cases, bloating can become severe enough that it causes distention or a perceptible swelling of the abdomen. Bloating and gas are usually tied to what and how you eat, so a few simple changes may help. To know how actually it feels, let's move forward and see what normally a patient complains about. When patient visits the doctor, he mentions abdominal pain, discomfort, cramps, and sometimes pain may be felt towards back. The discomfort in the belly occurs after eating. In addition, you will observe patient's abdomen appear large and feel tight or hard to the touch. So, what can make it worse? Bloating occurs when the abdomen fills with air or gas. Meals, certain positions, and eating particular food can make this worse. After knowing the reasons that worsen the condition, let's see what makes it better. Doctors advise belching to patients because it helps to expel air from the stomach through the mouth. It usually occurs when the stomach distends or expands because of too much swallowed air. It releases the air to reduce the distension. Antacids also used to ease the condition. Antacids are medicines that counteract the acid in your stomach to relieve indigestion and heartburn. Now, when patient visits the doctor, let's figure out the important questions that doctor will ask patient about. Doctor will ask you history or recent medical history that might trigger this condition, which includes abdominal pain, nausea, vomiting, change in bowel habits, black stools, change in abdominal girth, greasy bowel movements, weight change, gas, belching, regurgitation, anxiety, depression, relation of bloating to bowel movements, results of previous X-rays or ultrasound examinations. Your doctor will want to know if you or anyone in your family has had any of these conditions. Next, abdominal surgery, ulcer disease, colitis, diverticulosis, alcoholism, liver disease, hiatus hernia, obesity, emotional problems. Then, your doctor will want to know the nature of your pain and where it occurs. The feeling can range from mildly uncomfortable to intensely painful. It causes pain, cramps, or a knotted feeling in the abdomen. Left-sided abdominal pain is usually a sign of excess gas. This is especially true when the pain is not very strong, or if it feels like a stabbing pain that comes and goes. The most common cause of stomach pain and bloating is excess intestinal gas. If you get a bloated stomach after eating, it may be a digestive issue. It might be as simple as eating too much too fast, or you could have a food intolerance or other condition that causes gas and digestive contents to build up. Lastly, your doctor would also want to know if you're taking any of these medications like heart medications such as calcium channel agents, antidepressants, tranquilizers, antacids, antispasmodics, opioids, multivitamins, and iron pills. After knowing the history, it's important to go for a proper physical examination that include the assessment of weight, pushing on the abdomen, checking stool for the presence of blood. Now, as you have examined the patient, let's move towards the causes of bloating and what is typical for each cause. If your patient complains about bloating, belching, gas, chronic, worsened with certain foods, then it could be the indication of aerophagia. You must be wondering, what is aerophagia? Aerophagia is characterized by excessive air swallowing. The air enters the gastrointestinal tract and causes a range of symptoms. The word aerophagia means air eating in Greek. Next, if patient complaints, bloating, belching, gas, chronic, worsened with certain foods, then it could be flatulence. It is the term for releasing gas from the digestive system through the anus. Next, if patient mentions diarrhea caused by certain foods, greasy bowel movements, weight loss, then it could indicate the digestion problem. It includes the inability to digest certain foods and difficulty absorbing nutrients from foods. Next, if patient complaints, weight loss, abdominal pain, change in bowel habits, nausea, vomiting that could be due to gastrointestinal problems. These are the disorder of the stomach or intestines. Next, if patient complaints for swollen belly, it could be ascites. It is more commonly observed in people with history of alcoholism and liver disease. Ascites is the abnormal collection of fluid in the abdomen due to liver disease. Whereas brief episodes of crying and writhing, bowel sounds, often relieved by passing gas, it occurs only in newborns and infants. It indicates colic, which is sudden and sharp abdominal pain. Next, if patient complaints, cramping, diarrhea, constipation, with minimal pain but no fever, then it could be irritable bowel syndrome. It is alternating diarrhea and constipation, sometimes occurring during periods of anxiety. That's all for now. You can boost your knowledge and clear your concept by evaluating symptoms that help to diagnose the disease. Stay tuned for more only on sqadia.com.